The International Candlelight Day is commemorated annually to remember people who died of AIDS, as well as those who have made a positive contribution to the fight against the disease. The event was organized by Uganda AIDS Commission under the theme Ending HIV by 2030, Communities Leading in HIV/AIDS Care and Treatment. The event, held at Kitante Primary School in Kampala, attracted many government officials led by the Minister for Kampala HajjatKabanda, who represented the Vice President. Minister Kabanda confirmed government's directive to all television and radio stations to carry HIV/AIDS messages on a daily basis to educate the population about the disease.
His Excellency the President directed that HIV messages be simplified in order not to confuse Ugandans. I have been informed that Uganda AIDS Commission has reviewed all the messages and are now ready for dissemination. My sister, the Minister for Health, I think you hear that statement. I therefore urge all implementers of HIV and AIDS prevention and control activities to use unified messages and disseminate to the grassroots.
The directive comes at a time when the country is still registering new HIV infections, particularly among young people.
Out of the 54,000 new infections, about 40% of those were young people between 15 to 24. And out of those, 1 out of every 5 of the young people was a young woman. So young people are impacted more than the other population age categories, but the young female person is even more greatly impacted.
Minister of State for Health in charge of general duties, Anifa Kawoya, underscored the need to fight stigma and discrimination.
Ensure those who are living with HIV are called upon to come. It's still a big problem. Coming out. There is a fear. I wanted to hear from you, the guest speaker. There is a fear of those living with their HIV coming out.
Health development partners, including United Nations and United States of America, pledged their continued support to the fight against HIV/AIDS.
However, given credible fears that the AHA may impact our ability to support the delivery of key health assistance in a non-discriminatory manner, we are in the process of examining whether the AHA will jeopardize our programming.
I wish all of us really good reflections on this day, as we've been reflecting so well.
Uganda has an estimated 1.4 million people living with HIV, and the country is striving to end AIDS by 2030, implying that the disease should not be a public health threat. Sudat Kaye and Adia Nakuti, UBC News.